Hi, I'm Tom Mihawk, and this is Important Personal Finance Issues for May 2021 Graduates. I've assembled these for May 2021 graduates so we can talk about school loans, healthcare plans, purchasing a car, credit and credit scores, and purchasing consumer goods. All things you'll do. There are plenty of other issues in personal finance, like buying a home, you know, um, retiring, estate planning, all those are decisions you'll have to deal with, but not right now. But for May 2021 graduates, you will definitely look at these issues. And I want to try to provide some ideas for you in considering them. So, school loans. First, think about good debt versus bad debt, right? Good debt meaning to buy a home, to fund tuition, to pay for tuition for children, those sorts of things. Bad debt would be like to buy things that are wasteful, to increase your outstanding debt that's not going to help you much, maybe a vacation, an expensive car when you're young. A vacation meaning a very expensive one. I'm not saying a few $100s, but a very expensive one that maybe you should save for instead of borrow for. And know about your school loans, right? Know your outstanding balance, your monthly payment amount, interest rates, who you borrowed from. Chances are, if you've borrowed over a couple of years for college, you have borrowed maybe from several lenders, maybe even for several years, probably for. So you may have 6 loans outstanding. Know their repayment rules. When you're required to make payment, and know your grace periods. When are you required to start paying? 6 months, 9 months. In general, school loans tend to be good debt. You've done it. You've gotten school loans to finance an education. Challenge is if it's too high, particularly if it's too high relative to your earning, and that's when you have challenges. Now, here's some payment tactics for you. Consider budgeting a higher amount for your higher interest rate loans to pay them off faster. Get them off your personal book, so to speak. If you do, consider using the same total amount to pay off the remaining loans. Here's an example. Let's say your total loans are $300, pick an amount, and you decide to pay 400, an extra 100 going toward the part the loans that are your most high interest rate loans. Now, once they're paid off, consider still paying 400, which is 100 more than what you were required, but pay it all towards your lower interest rate loans. So you're paying first your high interest rate loans and then use the same paying more toward all of them, and then using that total amount to pay down, because you've already gotten used to it. Use that total amount to pay down your balance of your loans. Pay additional principal if possible. By doing this, you lower the amount of time that you pay your loans, you lower your loan balance, and you lower the total amount paid. Look for interest rate discounts, such as for scheduling automatic payment, right? It goes directly out of your account, you don't see it, happens automatically, and the lender likes that because it's easier. Understand about deferments and loan forbearance. You may qualify if you're not yet working. If you return to graduate school, I had school loans, both as an undergrad and in grad school. And when I was in graduate school, I deferred my undergraduate loans and then paid them all off when I graduated from grad school. And during the COVID pandemic also, you may be able to get a deferment or a loan forbearance. And forgiveness. There's the potential you could if your school closes before you complete your course of study, if payments could cause bankruptcy, if you become disabled, and certain teaching and public service professions also offer forgiveness. Some alternative plans, debt consolidation. This can decrease your monthly payment, primary reason you do it, right? But it usually increases the term. So instead of paying for 10, maybe now you pay for 15 years. And it may increase your interest rate also. So it's kind of not your first choice, kind of a last resort. If you've got to lower your monthly payments, consider a debt consolidation, which would also have the effect of putting all your loans together. If you have 6 school loans, maybe you put them under one loan. But by lowering your monthly payments, you're going to increase the term and probably increase your interest rate. Increasing or graduated payments you can sometimes negotiate this where you start out with a lower rate. You do it this way, lower, and it goes up over time. So theoretically, as your income increases over time, the amount of your payments toward your school loans can also, giving you a chance to have an affordable amount when you first start. Extend the length of time for repayment. It decreases your monthly payment and increases your total cost and amount paid. It's the same kind of as the debt consolidation, except you're only, in this case, extending the length of time for repayment. And income contingency plans can cap your payments at a percentage of your income. After a certain term, sometimes your debt may be forgiven. So the key of it is look these things up. Contact your lenders. Find out what programs exist. Look online. Find out what programs you should be considering or applying for. Okay, healthcare costs. Now, I'm not going to read every bullet in all of these slides because there are a fair number of them and a fair number of bullets. But I wanted to give you all the information that I could so that you'll want to read all the slides, which you'll have access to. Read all the slides, read all the information. We're just not going to go over all the bullets here. The U.S. has the highest per capita or per person as a percentage of GDP expenses for healthcare globally. The average per person cost is estimated to be about $10,600 in 2018, or almost 17% of gross domestic product. That's the total production of goods and services in the economy. It's high, it's very high. And by the way, you can find different numbers. When I was doing this research, this is a number that seemed consistent, but there are lots of different ways you can look at this. About 9.1% of Americans did not have health insurance in 2019, and this is lower than after the Affordable Care Act was promulgated. Here's an example of where the United States is, this chart, at about 17% of gross domestic product. Why are our healthcare costs in the United States so high? Well, we have sophisticated, expensive technologies. Have you ever had an MRI? It's this giant circular machine, and it's not made by small startup companies. It's made by GE and Siemens and these large industrial companies. Administrative inefficiencies, consolidation of hospitals. There's less competition. I had a client that I did work for 10 years ago. He ran, 2 hospitals or 3. Now he runs 10. Hospitals are consolidating under ownership and management. Longevity, increasing number of elderly, aging baby boomers, physician, healthcare, compensation, and rate of growth. All these things, litigation, all these things impact the cost of healthcare in the United States. Health insurance is a critical part of your personal financial planning. It reduces the financial impact of an illness or an injury. Group plans, where you work, 90% of plans are provided by employers in what are called group plans, versus individual, where you contract directly with an insurance company to get a healthcare plan. COBRA is a government act that requires that in a divorce or a separation from the company, you're able to still get insurance. If you divorce, the former spouse should be able to get insurance for another 36 months. If you're separated from your company, laid off, let go, reorged, you still have the ability to get insurance. The challenge is that generally when you were getting group insurance, your company was paying part of it. So now you have to pay all of it. So maybe before it was $500, now maybe it's $1,000, or before it was $800, now it's $1,200, something like that. But you do have the right to still get it. Here is a list. Again, I'm not going to read all these, but just gives you a general idea. Read the slides. It'll tell you the details. Leftmost is Health Maintenance Organization, HMO. Middle, Preferred Provider Organization, PPO. And on the right, High Deductible Health Plan. In general, the Preferred Provider Organization is most expensive but has lower deductibles, which means how much you pay out of pocket before the plan begins to provide you with benefits, and also provide you the greatest flexibility in choosing doctors. Health maintenance organizations, or HMOs, are today in the middle. They were the lower end, or the lowest end. Today they're in the middle. They have lower costs, but require you to pick doctors generally in a network, which means you have less flexibility in choosing the doctor that you want. And maybe in the last 10 years, high deductible health plans, they work very well for young people. If you're young, you should consider them. They have very high deductibles, so they're for people who don't use their plan very often, don't have expensive prescriptions, don't require elective or non-covered surgeries, and those sorts of things. So we're going to talk about that more. Managed care organizations became available about 30 years ago. I remember when they were new in the 70s. Health maintenance organizations hire doctors directly to provide care. You have to use, though, this network. So if you want to get a referral to have your knee operated on or have a particular kind of, I don't know, surgery, you may have restrictions in who you can choose. And the doctors that are in these networks are not always the best known, not always the most experienced. They're the doctors that want the business by being involved in these networks. This may prevent a constraint, not only for referrals, but based on where you live. The benefit of this plan is lower premiums and lower cost of premiums and services. A PPO is also a managed care organization. It negotiates discounted rates. There's also a network, but it's generally broader. You generally have more flexibility. Out-of-network physicians are available, but there's some limitations. Maybe you pay more for that. It offers more flexibility, generally more choice, and also charges higher premiums. When my children were high school age, getting injured playing high school sports and athletic activities and dance activities, we didn't want to have to worry about, reducing our healthcare costs too much for the benefit of saving, but for the corresponding negative of not having a very good network. And so we chose to use a preferred provider organization. In addition, we use the PPO because the high deductible plan, which was becoming very popular, really gave you a huge incentive not to use your insurance. And I didn't want to have, my son get stitches in a lacrosse game, and me have an incentive to, put some glue on it and tape and say, you know what, you're good, you're fine, you'll heal up. I wanted to be able to make sure we used an appropriate doctor and one that we could choose to have him treated. But for young people who don't have these kinds of situations, a high deductible plan is great. The premiums are generally lower. Now the deductibles are higher. For a family in 2021, this could be up to $14,000. That's high. Things that you would pay out of pocket would be things like surgeries that are not covered, expensive procedures, prescriptions, office visits, and these things you have to pay out of pocket until you meet your deductible. And by the way, it's not $14,000 for an individual. It is for a family in 2021. But people who rarely use health insurance can save money, particularly because you can connect it with a health savings account, which I'm going to talk about in just a slide or two. And these are great ways to save money. Out-of-pocket expenses are not market rate, but they're negotiated, so you can save some money. And policyholders can open this HSA, as I mentioned, this health savings account, and what you don't spend lower than your limit of your deductible, you roll into future years, which is a great way to do it. Here it is, health savings accounts. You have tax-deductible contributions from your paycheck. It's very attractive when combined with a high deductible plan. Very good for young insureds. Now, I work with all insurance people, and many of my older colleagues use high deductible plans, but it's specifically good for young people. The funds you don't spend on your health care can be rolled into the future. You manage it, you choose your investments, and when you leave one employer, you can take it to another. Flexible spending accounts are great also. You contribute money, it's pre-tax with payroll deductions, but there is a limit, and you want to make sure that you use up to the limit. You use these funds for things that aren't covered by your health plan, like orthodontia, child or elder care, eyeglasses. The funds you don't use, though, are forfeited. So don't do the maximum. And I'm not sure what that is now. Maybe it's $2,000. Don't do that if you can only find $1,000 of non-covered expenses, because you'll lose $1,000. Choose a lower limit, a lower amount you contribute to, and remember, by being pre-tax, $1,000, a $700 expense would be like the $1,000 expense would really be costing you $700 in a 30% tax bracket. That's a real benefit. How to reduce your healthcare plans. I was going to leave this out, but I wanted to include it. Focus on prevention. Stay fit. Eat a healthy diet. Track your health measures. Know your blood. Go when you see the doctor. Know what your blood measures are and keep them in the right ranges. Keep your weight in a healthy range. If you smoke, quit or keep it very minimal. Don't drink to excess. Those are excess calories. They can cause lots of other health problems. Be cautious about smoking and drinking. Get sufficient exercise. Get sufficient sleep. Relax from time to time. Drive carefully. Wear a seatbelt. Watch for accident and fire hazards in your home. Participate in a flex spending plan, health savings account. Just know the rules and use them properly. Keep good records. Choose the best health plan for yourself. If you make a mistake, choose a new one next year. You generally sign up at the end of the year during the, I forget the name of it now, the sign up period, and choose a new plan if you have to. Do the analysis, change when you need to, and use less expensive generic mail order or online for any long-term prescriptions you need. I'm Tom Mihawk. You can find me at tommihawk.com, YouTube, and at Resume Optimization, both Instagram and Twitter. Stay here for the segment 2 of important personal finance issues for May 2021 grads.